Hello, my name is Sierra Schaller-Mall, and welcome to my PowerPoint on health literacy affecting population health. According to Nash, health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. According to the World Health Organization, health literacy is defined as the cognitive and social skills which determine the motivation and ability of individuals to gain access to, understand, and use information in ways which promote and maintain good health. Health literacy is going to be addressed more throughout the decade as it is a Healthy People 2030 goal through the Department of Health and Human Services. Is health illiteracy an issue? The World Health Organization estimates that nearly 50% of Americans and Europeans have either basic health literacy or low health literacy. These rates of illiteracy increase in Asia and Africa. Risk factors for health illiteracy include advanced age, as the National Assessment of Adult Literacy Survey believes that 2/3 of U.S. adults over the age of 60 have inadequate health literacy skills. Another risk factor is low socioeconomic status. Minority groups, in particularly African Americans and Hispanics in the United States, as well as education. Health literacy is closely associated with education levels. Points of opportunity for health literacy include communication and time. In-reach opportunities include provider visits. Does the patient know what questions to ask during their visit? Do they know how to effectively communicate with their provider? Are there electronic medical record prompts for the provider to bring up discussion points? And is the patient motivated to pursue recommendations? Outreach opportunities are those in the public outside of the facility. These include emails, letters, phone calls, and home visits. During these points of contact, health literacy is whenever the patient is able to understand the material, and does the patient know or have the resources available to them to follow through with recommendations. Lack of health literacy results in failure to comply with screening protocols for chronic diseases. In the United States, 50% of medical visits are with a primary care provider. These are important for screening for long-term conditions such as hypertension. Long-term hypertension can cause stroke, aneurysm, weak and narrowed vessels in the kidneys, as well as eye damage and dementia. In the United States, 75% of cases of heart failure are due to long-term hypertension. Nearly 1 out of 2 Americans have hypertension, which is about 108 million people. Fortunately, many of these cases would be resolved with lifestyle modifications, which would be made at provider visits. Hyperlipidemia is also an issue in the United States, as the CDC estimates 102 million Americans have a cholesterol level greater than 200, and 35 million Americans have a cholesterol level greater than 240. This greatly increases the risk for heart disease and stroke, with heart disease being the #1 killer in the United States. Diabetes is also an important chronic disease state to be screened for, as complications can cause kidney failure, blindness, heart disease, peripheral vascular disease, as well as brain and nerve damage. Diabetes is a self-managed disease, which is important that health literacy is discussed during visits. There are 34.2 million Americans in the United States which are diabetic, which is about 1 in 10 adults, with 1 in 3 adults being pre-diabetic. Hispanics and African Americans are at high risk for diabetes. To help combat this disease, the Public Service Advertising has launched a campaign called doihaveprediabetes.org to help people understand the signs and symptoms of prediabetes and to seek out a provider. New diagnoses for diabetes tend to have some correlations, with 15% of them being routine smokers, 89% of new diagnoses of patients that are overweight, and 38% of diabetes diagnoses are patients that are physically inactive. According to the National Institute of Mental Health, 1 in 5 Americans, which is about 4.6 million, have a mental health disorder. Complications of untreated mental health often lead to chronic pain. Lack of health literacy often leads to the misuse of prescription medications. In the United States, more than 50% of parents make mistakes on dosing medications for their children. This is often due to a lack of understanding on units of measurement. It also comes from an unfamiliarity of syringes, cups, and droppers for dispensing meds. There's also a wide range of doses for pediatrics, which are often based on weight, age, and height. The rate of medication errors increase in Americans who are not proficient in English. Older Americans are also at an increased risk for medication errors, which are often due to age-related changes, such as difficulty seeing and reading the medication labels. According to the National Institute of Health, 40 to 50% of older adults take more than 5 medications a day. Older Americans are also more likely to use over-the-counter medications, complicating medication lists and profiles. Nearly 200,000 emergency room visits each year are due to medication errors. Half of these visits result in hospitalization. Over 66% of medication errors are due to unintentional overdoses. Medication errors in the United States often lead to 7,000 to 9,000 deaths a year. These include patient medication errors as well as provider medication errors. With this, health literacy is important not only for patients but also medical providers, as more than 1.5 million people are harmed in the U.S. every year from medication errors. Lack of health literacy also reduces cancer screenings. Cervical cancer was once a leading cause of cancer in the United States. Now there are nearly 14,000 cases annually with over 4,000 fatalities. The average age at diagnosis for cervical cancer is age 50. Fortunately, 74% of women between the ages of 45 and 64 undergo the recommended screening, which is a pap smear every 3 years. However, this is still 1 in 4 women who do not go screened. Most women do not know that the human papillomavirus is the main cause of cervical cancer, nor do they know that human papillomavirus is a sexually transmitted disease. Hispanic women are less likely to go screening, but they're more likely to develop cervical cancer. Research studies show that educating women increases cancer screening rates. Colon cancer is currently the 3rd leading cancer death for both men and women, with rates of colon cancer higher in African Americans. African Americans are believed to have greater exposure to risk factors, be underinsured, have lower screening rates, and have lack of follow-up after screening. This is often due to health illiteracy. Patient navigation systems tend to improve screening and treatment. Lung cancer is the leading cancer death cause in the United States, with signs and symptoms of cancer being prevalent when the cancer is in an advanced state. This makes screening important. Low-dose CT scans of the chest for screening reduces mortality by 20%. Patients who are candidates for the CT scan are those who have a 30 pack per day per year history and have quit smoking within the last 15 years or are current smokers. Unfortunately, as of 2015, only 5.9% of eligible candidates in the United States had the screening test performed. Lack of health literacy also leads to the underuse of preventative health services. This is often in the form of immunizations, as immunization rates are beginning to decline in the United States. In 2015, only 30% of females ages 13 to 15 were vaccinated in the United States for human papillomavirus, with vaccination rates as low as 10% on college campuses. Human papillomavirus causes 70% of cervical cancers and 50% of penile cancers, with nearly 79 million adults in the U.S. currently infected. 80% of men and 90% of women will be infected with HPV during their lifetime, making vaccination important before patients are sexually active. Childhood vaccine hesitancy is believed to be due to lack of health literacy, as most parents look at sources outside the provider visit for information on vaccines. Research has also shown that interaction with healthcare providers makes patients less likely to vaccinate. Health literacy contributes to poorer population health. When providers are talking with their patients, it's not only important that they explain health information, but they also ensure that patients understand the health information. According to the Agency for Healthcare Research and Quality, they don't recommend screening for health literacy. They say it's better to take universal precautions and assume everybody has low health literacy. Utilizing electronic medical records also prompt talking points during visits. Providers can also advocate for health literacy classes in high school alongside regular health classes. There's also free training on the CDC website for health literacy improvement during provider visits. Thank you for watching this presentation, as the next 2 slides will go through the credits. Thank you.